Hey everyone, welcome back to Speak Healthy. Today, we are going to talk about 7 strategies to reverse high blood sugar and insulin resistance. High blood sugar and insulin resistance are 2 conditions that are closely linked and can lead to serious health problems such as type 2 diabetes, heart disease, and stroke. High blood sugar occurs when the body cannot properly process glucose, which can result in elevated levels of sugar in the blood. Insulin resistance occurs when the body becomes less sensitive to insulin, a hormone that helps regulate blood sugar levels. While medication is often prescribed to manage these conditions, there are also unique strategies that can be used to reverse them. In this video, we will discuss some of these strategies that can help improve blood sugar control and insulin sensitivity, leading to better overall health outcomes. Number 1. Intermittent fasting. Intermittent fasting is a dietary strategy that involves alternating periods of eating with periods of fasting. This approach has gained popularity in recent years due to its potential benefits for weight loss and overall health. During the fasting period, a body switches from using glucose as a primary energy source to using stored fat, which can result in weight loss and improved metabolic health. Studies have shown that intermittent fasting can also help improve insulin sensitivity and lower blood sugar levels. One study published in the Journal of Clinical Endocrinology and Metabolism found that after just 6 weeks of intermittent fasting, participants with prediabetes had a 50% increase in insulin sensitivity and a 4 to 6% reduction in fasting blood sugar levels. Another study published in the journal Nutrients found that intermittent fasting led to significant improvements in blood sugar control in overweight and obese adults with type 2 diabetes. One theory behind the benefits of intermittent fasting for insulin resistance and blood sugar control is that the fasting periods allow the body to rest and repair, reducing chronic inflammation and oxidative stress that can contribute to these conditions. Additionally, fasting may trigger the production of certain hormones such as growth hormone and glucagon, which can help regulate blood sugar levels and improve insulin sensitivity. Number 2, exercise. Regular exercise is a key component of a healthy lifestyle, and it can play an important role in improving insulin sensitivity and blood sugar control. When we exercise, our muscles use glucose for energy, which can help lower blood sugar levels. Exercise also helps improve insulin sensitivity by increasing the number and activity of insulin receptors on the surface of our cells. Studies have shown that both aerobic and resistance training can be effective at improving insulin sensitivity and blood sugar control. Aerobic exercise such as running, cycling, or swimming can help increase the body's sensitivity to insulin and improve glucose uptake by the muscles. Resistance training, on the other hand, involves using weights or other resistance to strengthen and build muscle. Resistance training can also be effective at improving insulin sensitivity as it increases muscle mass and the number of insulin receptors on muscle cells. In fact, research has shown that resistance training may be particularly effective at improving insulin sensitivity, especially in people with type 2 diabetes or prediabetes. One study published in the Journal of Diabetes Research found that just 12 weeks of resistance training led to significant improvements in insulin sensitivity and blood sugar control in overweight and obese adults with prediabetes. Number 3, low-carbohydrate diet. A low-carbohydrate diet is a dietary approach that emphasizes reducing the intake of carbohydrates while increasing the intake of healthy fats and proteins. This diet has been shown to be effective at improving blood sugar control and insulin sensitivity, particularly in people with prediabetes or type 2 diabetes. Carbohydrates are a primary source of glucose in the body, and reducing their intake can help prevent rapid spikes in blood sugar levels. By reducing carbohydrate intake, the body is forced to store fat for energy, which can lead to weight loss and improved metabolic health. Studies have shown that a low-carbohydrate diet can be effective at improving blood sugar control and insulin sensitivity. One study published in the Annals of Internal Medicine found that overweight adults with type 2 diabetes who followed a low-carbohydrate diet for 6 months had a significantly better blood sugar control and insulin sensitivity compared to those who followed a low-fat diet. Another study published in the Journal of Clinical Endocrinology and Metabolism found that a low-carbohydrate diet led to significant improvements in insulin sensitivity and blood sugar control in overweight adults with pre-diabetes. In addition to improving blood sugar control and insulin sensitivity, a low-carbohydrate diet may also have other health benefits such as reducing inflammation, improving cholesterol levels, and promoting weight loss. Number 4. High fiber. Fiber is a type of carbohydrate that is not digested by the body, meaning it passes through the digestive system without being broken down into glucose. As a result, it does not contribute to rapid spikes in blood sugar levels. Instead, fiber slows down the digestion of other carbohydrates, which can help prevent rapid fluctuations in blood sugar levels and improve overall blood sugar control. Studies have shown that a high fiber diet can be effective at improving insulin sensitivity and blood sugar control. One study published in the American Journal of Clinical Nutrition found that overweight adults with type 2 diabetes who followed a high fiber diet for 6 months had a significantly better blood sugar control and insulin sensitivity compared to those who followed a low fiber diet. Another study published in the journal Diabetes Care found that increasing fiber intake by just 10 grams per day led to significant improvements in blood sugar control and insulin sensitivity in overweight adults with type 2 diabetes. In addition to improving insulin sensitivity and blood sugar control, a high fiber diet may also have other health benefits such as reducing inflammation, improving cholesterol levels, and promoting weight loss. Number 5. Stress reduction. Stress is a natural response to challenging situations, but chronic stress can have negative effects on health, including blood sugar control and insulin sensitivity. Stress hormones such as cortisol can increase blood sugar levels and contribute to insulin resistance, making it more difficult for the body to use insulin effectively to regulate blood sugar levels. There are various strategies that can be effective at reducing stress and improving insulin sensitivity. One such strategy is meditation, which involves focusing on the breath or a mantra to calm the mind and reduce stress. Studies have shown that regular meditation practice can improve insulin sensitivity and blood sugar control in people with type 2 diabetes. Yoga is another strategy that can be effective at reducing stress and improving insulin sensitivity. Yoga combines physical postures with deep breathing and meditation, making it a holistic approach to stress reduction. A study published in the Journal of Alternative and Complementary Medicine found that practicing yoga for 12 weeks led to significant improvements in blood sugar control and insulin sensitivity in people with type 2 diabetes. Deep breathing exercises such as diaphragmatic breathing and alternate nostril breathing can also be effective at reducing stress and improving insulin sensitivity. These exercises help activate the parasympathetic nervous system, which is responsible for the body's rest and digest response. A study published in the Internal Journal of Yoga found that practicing deep breathing exercises for just 15 minutes a day for 2 weeks led to significant improvements in insulin sensitivity and blood sugar control in people with type 2 diabetes. Other stress-reducing strategies that may improve insulin sensitivity and blood sugar control include getting regular exercise, spending time in nature, and spending time with loved ones, and engaging in hobbies or other enjoyable activities. Number 6. Sleep. Sleep is an essential component of overall health, and lack of sleep can have negative effects on many aspects of health, including blood sugar control and insulin sensitivity. Studies have shown that chronic sleep deprivation can increase insulin resistance and lead to higher blood sugar levels, making it more difficult for the body to regulate blood sugar effectively. There are several reasons why lack of sleep can impact blood sugar control and insulin sensitivity. One reason is that sleep deprivation can lead to changes in hormone levels that affect glucose metabolism. For example, sleep deprivation can lead to increases in cortisol, which can increase blood sugar levels and contribute to insulin resistance. Another reason why lack of sleep can impact blood sugar control is that it can lead to changes in appetite and food choices. Studies have shown that people who are sleep deprived are more likely to crave high carbohydrate and high fat foods, which can contribute to rapid fluctuations in blood sugar levels. Getting adequate sleep is crucial for maintaining healthy blood sugar levels and improving insulin sensitivity. The National Sleep Foundation recommends that adults aim for 7 to 9 hours of sleep per night, although individual sleep needs can vary. In addition to getting adequate sleep, practicing good sleep hygiene can also be beneficial for improving insulin sensitivity and blood sugar control. This can include establishing a regular sleep cycle, avoiding stimulating activities such as screen time before bed, creating a comfortable sleep environment, and avoiding caffeine and alcohol close to bedtime. Number 7. Supplements. While a healthy diet and lifestyle are the foundation of good blood sugar control and insulin sensitivity, certain supplements may also be helpful in improving these measures. However, it's important to note that supplements should never replace medical treatment or lifestyle changes and should always be taken under the guidance of a healthcare provider. One supplement that has been shown to improve insulin sensitivity and blood sugar control is magnesium. Magnesium is an essential mineral that plays a role in many cellular processes, including glucose metabolism. Studies have shown that magnesium supplementation can improve insulin sensitivity and lower blood sugar levels in people with type 2 diabetes. Another supplement that may be helpful for improving insulin sensitivity is chromium. Chromium is a mineral that plays a role in insulin signaling and glucose metabolism. Studies have shown that chromium supplementation can improve insulin sensitivity and blood sugar control in people with type 2 diabetes. Alpha-lipoic acid is another supplement that has been shown to improve insulin sensitivity and blood sugar control. Alpha-lipoic acid is an antioxidant that plays a role in cellular energy metabolism. Studies have shown that alpha-lipoic acid supplementation can improve insulin sensitivity and lower blood sugar levels in people with type 2 diabetes. It's important to note that while these supplements may be helpful for some people, they are not a substitute for a healthy diet and lifestyle. Additionally, supplements can interact with medications and may not be appropriate for everyone. It's important to talk to a healthcare provider before taking any supplements to ensure their safety and effectiveness.